Hi everyone, I am Dr. Anu and today I'll be discussing about HPV vaccination. This is a very important vaccine which is for the prevention of cervical cancer and other benign condition in males and females. So this is a part of the adolescent vaccine series, and let's discuss about the types of vaccination that is available, the diseases that is prevented by the HPV vaccination, and also the schedule. So let's get started. If you find this video useful, please don't forget to share it with your friends and leave a like and comment if you have any doubts. So HPV vaccination. So HPV is the highest attributable fraction that is reported for a specific cause of human cancer. This causes invasive cervical carcinoma. The lag period between an oncogenic HPV to an invasive cervical cancer is 15 to 20 years. So in the earlier time, we will not be able to find the symptoms and give a treatment until and unless we do a proper screening. And cancer of the cervix uteri is the second most important cause of cancer in women. So you have to remember that HPV is common, cervical cancer is serious, but prevention is powerful. And for the prevention of cervical cancer, we have two methods. One is vaccination, second is screening. So vaccination is the introduction of HPV vaccines, and screening is by the pap smear. So cervical cancer is preventable as it has a long pre-invasive stage, and screening and treatment is possible in early stages with high success rate even in rural India because pap smear is a very simple test. Coming to the pathogen, HPV type 16 and 18 causes 70% of all the invasive cervical cancer worldwide, and type 16 has a great oncogenic potential. So type 16 has greater oncogenic potential. Low risk types like 6 and 11 are responsible for 90% of the anogenital warts and respiratory papillomatosis. So HPV 16-18 vaccines will provide over 80.3% protection against invasive cervical cancer in South Asia. So coming to HPV vaccination, we have nonavalent vaccine and the quadrivalent vaccine. The quadrivalent is the Gardasil 4 and the Cervavac, and the nonavalent is the Gardasil 9. So the HPV type 6, 11, 16, 18, which is causing the more common diseases, is included in the quadrivalent vaccination. And in Gardasil 9, we have 9 strains. That is the most important one, 6, 11, 16, 18. Apart from that, we have 31, 33, 45, 5, 2, and 58. So the composition, it has 225 micrograms of amorphous aluminum hydroxy polysulfate as a adjuvant, and the age recommendation for Gardasil is recommended for females between 9 to 45 years. For Gardasil 9, it's 9 to 26 years in female, and for males it is 9 to 14 years. In Cervavac, it can be given to both males and females from 9 to 26 years. So at the earliest if the vaccination is given. So ideally before the sexual contact or the exposure to the HPV virus, the vaccination has to be given. Ideal time is the adolescent age group, or at least as early as possible, at least less than 25 or 26, and maximum you can give up to 45 years. So in male also, if it is Cervavac, we can give up to 26 years. So 4-valent, quadrivalent HPV vaccine Cervavac. So this is the one which is developed by the Serum Institute of India, and the side effects of this include very mild side effects like pain and headache. So indication, so let's discuss the common indications for women from 9 to 26 years. This can be administered. This will help in prevention of cervical, vulvar, vaginal and anal cancer caused by HPV 16-18. Genital warts, that is the condyloma acuminata caused by HPV type 6 and 11. Cervical intraepithelial neoplasia grade 2 and 3. Cervical AIS and CIN, that is the cervical intraepithelial neoplasia grade 1 caused by type 6, 11, 16, 18. Vaginal intraepithelial neoplasia grade 1, 2 and 3 and 4. 1, 2 and 3, and anal intraepithelial neoplasia grade 1, 2 and 3. And boys from 9 to 26 years, it can help in prevention of anal cancer, genital warts and anal intraepithelial neoplasias. So this is very important prevention of all the genital cancers, that is the cervix, vagina and the anal cancers, which is caused by HPV virus, which is transmitted sexually. So before the person gets into a sexual contact, if the vaccination is given, the success rate or the prevention rate is very high. So coming to the schedule, Servavac can be given for both boys and girls from 9 to 14 years. It's a 2-dose schedule, 6 months apart, 0.5 ml, and the interval between the first and second dose should not be less than 5 months. If the person crosses 14 years, that is between 15 to 26 years, it is a 3-dose schedule at 0, 2 and 6 months. The second dose should be 1 month after the first dose, and the third dose should be at least 3 months after the second dose, and all 3 doses has to be given within 1 year. If this time frame is not followed, then that dose of vaccination is not considered valid. So HPV vaccination storage is between 2 to 8 degrees, and the site is at the deltoid. It has to be given intramuscularly, 0.5 ml, and can be given with hepatitis B vaccination and Tdap, because you know that at 15 years and 10 years, the child will come for a TD vaccination. The adolescents may come for hepatitis B vaccination. So along with that, you can offer HPV vaccination for these children. The contraindication include hypersensitivity and pregnancy. So if a person has not received catch-up vaccination, to females can be given up to 45 years, which is quadrivalent, and nonavalent can be given till 26 years. Use recommended routine dosing intervals for the vaccine catch-up also. So this has to be kept in mind. So in adolescent age group, up to 14 years, 2 doses, up to 26 years, 3 doses. Quadrivalent can be given up to 45 years, nonavalent can be given up to 26 years. The efficacy is maximum when it is given as early before the sexual exposure, preferably in the adolescent age group. So this has to be administered to all the children visiting the adolescent clinics, and the efficacy of this vaccination and the prevention of cervical cancer has to be educated to their parents. As a pediatrician, this is our role to do it. So thank you for watching the video, and subscribe to my channel for more videos on pediatrics. Thank you.